Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So hello and welcome to the Healers Café. And today I'm with Dr. Heli McPhie. And she's had a passion for medicine and healing, which began at a very young age, growing up in Zambia and in South Africa and South Africa. And building upon her love of the natural world and science, she completed her undergraduate degree in biology at McGill University, and then went on to complete a 4-year study of natural medicine at the Canadian College of Naturopathic Medicine. Then she completed 2 years of clinical practice in Toronto and then returned to the West Coast to continue her career. She has operated a successful family practice for over 20 years, seeing patients of all ages from all over the Lower Mainland, across Canada and abroad. Dr. McPhie lectures frequently at universities, colleges, and to the public, and she has a passion for creating community. She was the recipient of the David Schleck President's Award of Excellence and the Dr. Patricia Wales Award for her significant contribution to the development of the naturopathic profession in Canada. She was also recognized by UBC as Mentor of the Year for her many years as a mentor in the nutritional science program. So welcome.
Oh, thank you.
All right. So first question.
It's always strange to hear one's life written in a paragraph.
I know, it's like, really?
Oh, okay.
I know, it's funny how you write a bio and then it's like, you know, life goes on and it continues and,
Wow.
you know. So anyhow, but so let's talk about, my first question is, when did you know, or how did you know that you were going to go into the healing field or healing arts, or you were going to be a healer, whichever way you want to resonate towards?
Well, I knew that I wanted to be a doctor when I was probably 4. I was in Zambia, and a friend of mine was brutally attacked by a dog, and right in front of me, my dear friend. And he ended up in the hospital. He was very young. And he ended up, I think, with over 200 stitches and survived. And I remember thinking, I have never not felt like I didn't want to be a doctor since. So I've just always known, I was medical school bound. And so I was heading towards UBC medical school and got in, and it just didn't fit. And a naturopathic doctor here in Vancouver urged me to try Dr. Matson, right? You remember Dr. Matson from the urged me to go into naturopathic medicine. And I'd just been focused on something for so long that I was kind of taken aback. But then when I thought of it, I recognized that it actually fit me better. And so it's strange how life can take these sort of right angle turns sometimes. Yeah. And so it did. And now I've been doing this for 20 years. This is I guess I've been practicing now for 22.
Yeah. Interesting. Yeah. But I mean, the heart and soul of becoming a doctor, whether it's, you know, a medical doctor or naturopathic doctor, you still want to help people, right? Yeah. I mean, it's, you know, it's the same in that sense, you know, but because it's funny, I had very similar history. I was also accepted, you know, for medical school, and my big heart at that time was homeopathy and just knowing what it was I needed to know about the human being and pathology. And I looked at the programs and I went, well, yeah, interesting. One of them really has all the diagnosis and stuff, but we have that in the other, but the other one has interesting other solutions. Right. So I was like, okay, well, I could do with understanding nutrition a little bit better and Chinese medicine. And so what was it for you when you say it didn't, you shifted? What attracted you? Because I think there's a lot of people now that are wanting to be doctors, but they're kind of stuck and they don't know where they should go.
Yeah, you know, I'm a collaborative ND. So I believe in that no one paradigm has all the answers, right? Homeopathy doesn't, naturopathic medicine doesn't, Western medicine doesn't. Because if one paradigm did, there'd be a lot fewer illnesses or a lot fewer sick people.
Totally.
Right?
Yeah.
But you start putting them together and you get better healthcare for people overall. It's so it's my soapbox. I love it. I love the fact that I can have my one foot in the art of medicine because I have time with people and I want to hear their whole story, and I want to know how they are eating and how they're feeling and where their emotional health is at, how they're doing energetically. And then, you know, one foot in the art of healing and one foot in the science of it, right? Because naturopathic medicine, as you know, is sort of medicine backed, natural medicine, but backed by science. It's not just random, right?
Right. No, I was going to say, it's not, the distinction to me is not the science in both, because they both have science.
Yeah,
you know,
they do.
right. But so what is it that, because you were saying naturopathic medicine has all these components. What is it? And I totally agree with the integrative approach. I think that we should be all working together for sure. But what is it that you feel are the, when you're looking in a clinic, and you know, many people are looking to have a full integrated clinic, what are you looking for in the qualities of what an MD or that profession has to offer?
What I find so powerful in naturopathic medicine is our ability to question, right? But also our openness. We're open to possibilities. We're open to the idea that something else might be going on. I have a lot of patients that come to see me, right, that have really exhausted all their options in Western medicine and have been told that, well, you're fine, you're just tired. Or, you know, drink more coffee, one of my patients was told. And so I love it when we can look at something from the possibility of something else and have tools for helping that. That is what makes me excited, right? I love the fact that my toolbox is vast, right? It has Bowen, it has acupuncture, it has homeopathy, nutritional medicine, botanical medicine, counseling, massage, body work. All of that is in there. And when your toolbox is that vast, when you see a patient, I don't know if you have this, but when I hear a patient, you can hear what tool they want to use, right?
Yes.
You can hear when someone is speaking that they need a homeopathic remedy. You can hear when someone is speaking that they need acupuncture, you know, if they need Bowen. And so I loved the idea of truly going after the fundamental cause, not just hiding symptoms. That felt like doing something really well. And I loved that idea. You know, a lot of people, I don't know if you've had this, but I mean, it's not as much now, but people used to come into me and whisper, my medical doctor doesn't know I'm here.
Oh yeah, I've had that all the time. And it's like, that's okay. We'll give him a call if you want.
and I often think how silly that is. I'm like, well, why? I would love it if doctors on both sides put their egos aside, right? And started working together, because there's a lot of fear-based, I still hear the argument, I don't know if you do, but I still hear the argument, well, naturopathic medicine has no research behind it. And I'm like, really? Have you looked in a journal? Because how many GPs are out there doing research, right? Like, I don't know of a lot of GPs. And so that we often get that argument, right? Well, naturopathic medicine doesn't do its own research. Well, how many GPs are doing their own research, right? But we do benefit from the research that has been done out there. Absolutely. So I love, because I see it all the time, when we collaborate within our clinic with the patient's medical doctor, with the counselor in our clinic, with Bowen therapy, with physiotherapy, with whatever the patient needs or is calling for, what their body is calling for, the results are mind-blowing. Yeah. I mean, my team and I, we remind ourselves in staff meetings to not get complacent with the little miracles that we see. Right? Because, you know, when someone has been feeling awful for a decade, and then within a month, they feel like they're sleeping and they're feeling better and their head doesn't hurt and they're not brain foggy and their digestive tract is working better and you know, we kind of go, we nod and go, right. But I'm like, hey, wait a minute. They felt awful for a decade. Let's just celebrate this little miracle a bit. I love that. So, I mean, I think that's what my own success with naturopathic medicine before I went to medical school perked my interest. And then I worked with Dr. Mattson for a bit to see what and how it worked and what naturopathic medicine was. And then I saw a couple of other doctors, and then I was sold, right? Then I knew that was it for me. This fit better, and that I would probably work with other medical doctors in life, because I'm grateful for antibiotics. Every now and then we need them. Yeah. I'm grateful for medicine. I'm grateful for surgery. I'm grateful for cancer treatments. I just think that it's important for us to be open to other possibilities.
Mm-hmm. But I think you really hit on a very important point, and it is that openness, which is very different, because I have colleagues that are medical doctors or that have come to see me even in, as patients. And the main thing is they can be good at diagnosis, but everything is very limited in its solutions compared to when you have a million ways of treating something. Then you also put in question, what am I actually treating? What is the bottom? What's underneath this? And, because we could act physiologically the very same way and give natural substitutes for, pharmaceutical drugs, but that's not doing proper naturopathic medicine. It's not listening, to the patient.
I think, when you're truly treating the cause, like when you're treating the underlying cause, and when you believe in the healing power that the body is always trying to heal, and the healing power of nature, it is the more I practice, Manon, the more that just, I don't know, it's like Prosecco bubbles. It makes me kind of excited.
That's funny.
It just does, because there's power in that. And so I know that if we could harness that and make it part of the mainstream, it would be so terrific. I think historically, medicine got very excited when they got antibiotics and when they got certain pharmaceuticals to treat, right? But if you think about it, it changed acute medicine, right? It changed acute medicine. Someone needed a painkiller for a bone break. Someone needed an antibiotic for a bad wound. That was exciting medicine. But what's happened is that now we think that pharmaceuticals will solve every problem, right? And I don't think that you can cure a lot of the chronic illnesses. You can mask them, but you can't necessarily cure them with a pharmaceutical. Like you just can't. You can prolong people's life, and you can make them seemingly feel better, right? But are we actually helping long term? And so, I love Steve Jobs had a beautiful quote. I'm sure you know it. Something like, if you don't allow medicine to be your food, at some point, if you don't allow food to be your medicine, right? At some point, medicine will be your food.
Yeah, I think I've seen that one. Is it him who came up with that? That's good.
Yeah, I think that I think if we allowed naturopathic doctors, and if it became sort of the norm that we did more work with the chronic issues and worked collaboratively with MDs, our medical costs would go down so drastically. I see it time and time again. I know you have. I'm sure you have, right?
Absolutely.
You look at things like blood pressure, cardiovascular illnesses, mood disorders, which is what my passion is. I'm hoping we talk about that. Eczema, allergies, all of these sort of chronic digestive issues, IBS. I mean, IBS to me is not a diagnosis, by the way, it's a description. Your bowels are...
Oh, exactly.
No. Right? No. Chronic fatigue syndrome, that is not a diagnosis, it's a description. Fibromyalgia, sore muscles, not a diagnosis, it's a description. What's underlying all of these? I'm fascinated by that as a biologist, right? I think vectors are going to come into our playing field in a much bigger way in our medicine's future. Kind of like inflammation is the trendy thing now, right?
Right.
We're finally starting to see that maybe egg yolks weren't the demise of our cholesterol, and maybe we should be focusing a little bit more on inflammation instead. So, don't even get me going. I'll get so passionate about this stuff.
This is great. No, I love speaking to people who are passionate about what we do, because one of the biggest things, and I think you nailed it, it gives people hope as well, but not like the hope that is like, oh, it's just all in your head. No, it's the hope that what they're feeling is for real. And just because you can't, put it, even if you can put it in a box, the labeling of the box is not the solution, right? It's like, you've got, IBS. Okay, now let's look, why do you have IBS and why do you have anxiety? And why do you have, like, there's a lot more connected. And that's the part about being, like the, what's the right word in English? The detective, I just love, it's like, okay, we're going to get this, now we're down to maybe this system could be that where we will start, or, but the interrelationship of the way our entire body works, that I just find that so exciting. And then sharing that with people is, I think, that the most exciting part. They feel like they're part of their health journey. It's not like we're just telling them you've got this and take that, and that's what I find so rewarding, is that they're getting interested. And then I found that the patient then kind of goes, do you think that this might have impacted me? And it's like, the fact that they think it makes it likely true, because we all know inside what's really affecting us, so anyway, I just find this whole...
I think it empowers. What I love about natural and naturopathic medicine is that we are empowering our patients, right?
Exactly.
We're allowing them to be in charge and take control of their healthcare. I mean, I think if this pandemic has shown us something, and hopefully taught us anything, it's that we have to take control and be in charge of our well-being, mentally and physically. Like, we can't just say, okay, I'm going to, not take care of my health, be in very poor condition, and then if I get some kind of a virus, well, let's hope that healthcare will take care of it, right? And sort of giving it over to someone else. I think this virus showed us that, those people that are not healthy, there is not necessarily anything that can be done. But you can do lots of things to help prevent that. I'm very, very concerned and passionate about making sure that our patients in clinic know that as much as possible, and working with the doctors within our community to say, hey, you know what? It doesn't have to be complicated, but we do need to improve the health of our patients, because there has been, there's been this idea that, well, if I get high blood pressure, I'm going to take blood pressure pills. Well, if I get high cholesterol, I'm going to take cholesterol pills. Well, if I get allergies, I'll take allergy pills. If I get pain, I'll take pain pills. If I have a low mood, I'll take mood pills. Really? Well, what happens if you're not healthy? There are no unhealthy pills, right? There's, this virus showed the weakest link in all of us. It did. So I'm hoping before the next round or wave, even though I think we're already in the second wave, if we can convince our patients and their doctors that we have a role to play in chronic healthcare, that will be a huge life lesson, a silver lining from this whole thing. If doctors start working together more, right?
Yeah,
egos are put aside, right?
Yeah, I think the egos need to be...
and ignorance. When I was younger, I always worried about egos, right? Sort of being down talked to by Western medical doctors. I no longer have that at all. I just don't think that there is room or space in medicine for that.
And I think too, we need to also look at the systems that facilitate. It's, it's rare that it's just the individual doctor, whether it's a naturopathic doctor or a medical doctor, that's the root cause of the systemic problem. It's usually the system that we tend to accept, you know. And when you look at allopathic medicine, you know, it's the generalist, your GP, then sends you to specialists, and the specialists don't talk to each other. And you're basically, as a patient, your experience is that there's potentially a solution, at least a pain management or a symptom management solution for every body part. That's how they come out of it. And that's reinforced because even the GP doesn't necessarily see the patterns involved until they become sick. And then, you know, and they need to look for different solutions, you know. So it's been very interesting to watch.
But, you know, to be fair, I have friends that are GPs, and it's hard to diagnose in a complex case in the short period of time that they have per patient, right?
But so that's a systemic problem.
Yeah, I mean, I feel for them. And we've talked about this, that, okay, well, how do you actually then fully collaborate with someone? And because we have time, I mean, I am so grateful for the time that I have with patients, right? I have an hour or sometimes more is needed, right? To get the entire case together and to really look at. And often it takes several visits until the full picture starts coming through, right? I don't know about you, but I've had many patients that tell me the most important part, oh, by the way, as they're walking out the door.
Yeah.
Right. So if we started working together, you know, the GPs and Western medicine, it's brilliant acutely. It has amazing things to offer.
Hi, this is a small commercial break, and for you to let me know that you're enjoying these conversations, please go 1, to subscribe to my podcast. Number 2, write a review, because if you write a review on iTunes, more people know about this, and I can help spread the work, my work, but the work of everyone else I'm interviewing. And number 3, please sign up to my tips for your healing journey. And you can do that under www.drmanonbolliger.com/tips. Thank you.
I'm grateful that we have it. But wouldn't it be miraculous to see the change in healthcare if we started working together?
So, well, let's talk about mental health, because that is also one of the, you know, we've been so much focused at the fighting the virus, the outside attacker kind of thing. And we're noticing that so many people are suffering from isolation, from lack of care, from loneliness, from mental health. So what are your thoughts on that? And since you said it's a passion,
connection and community have been a passion of mine for a while now. I'm just contemplating whether to do a master's in looking at loneliness as a major social determinant of health. I think some countries have already recognized that it is a huge issue for us. You know, there's that classic line that loneliness is more detrimental to your health than smoking, because of that study that came out. And it's true. I mean, loneliness has been shown to increase inflammatory rates ubiquitously across your body. So of course it affects us profoundly, especially mentally and emotionally. So our clinic, and I am especially passionate about connection and creating connections for people. I think this pandemic highlighted how profound connections are, because we you know, I was just sitting outside with some friends yesterday, and we were also very grateful, and all of us said we will never take for granted seeing each other's face to face again. I mean, while I love seeing you by Zoom, I would be very much happier sitting on that deck with you right now having this conversation. Right? So I think the mental health effects of this pandemic, we are only now and later will start being revealed. I am just becoming more and more fascinated by that. You know, I'm a biologist. I know that we have evolved into these amazing social beings. We do better when we're together. We just do. I mean, if you think about it, Manon, we are not that awesome as a species. I mean, we don't have claws, we can't fly, we can't swim underwater, we don't have fangs, we don't have excessive speed, we can't see very far, right? We just don't. But you put us together and wow, the things we can do are incredible. And so we evolved as social beings,
Right.
but our history has sort of started celebrating the individual. Do it on your own. You can be number one. And that's led to a lot. And you know, these gadget things have led us to be even more isolated. And we need to start changing that a bit.
Yeah.
I don't think we've thought it through enough. You know, when cars first came out, we didn't have seatbelts. We drove wherever we wanted. And then people started going, well, we keep losing lives. Let's add some safeties to this. And that took until the late 70s and 80s, right? Because I remember bouncing around the back seat of my parents' car in Africa, right? Willy-nilly. And then we kind of, think how long that took, over 70 years for that to, right? So it's going to take us a while until we find safeties for these gadgets as well, and start incorporating them into our norms. They're not going away. Cars didn't go away, right? Yep. These gadgets will not, they'll evolve, but they're not going to go away. So us starting to look at how they are affecting us mentally and our connections and making sure that we're taking care of those is vital. It's vital. It's absolutely vital. Our clinic is starting to do more and more mental health collaboratively. So we use Bowen, right? I mean, I got to tell you, when Shan uses, Shan Rackham, a beautiful Bowen therapist at our clinic, when she does a vagal release, right? Or a vagal flush on someone that is hyper anxious or stressed.
Yeah.
I mean, it is wonderful to see that human being leave, to see that patient leave, because they often go, right? Yeah. And you know, we have a beautiful counselor, Susan Furtado, in our clinic that I love working with. And so I'll do the nutrition part or just their general health and well-being and looking at inflammatory rates, and she's doing the counseling. Shan's doing some Bowen. We have a wonderful physiotherapist, Florence McDonald Bain, that often makes sure that they're aligned. And it is incredible to see suicidal patients that are no longer suicidal, to see OCD patients that couldn't move off their stove, right? They had to turn it off for an hour, all of a sudden not even worrying about their stove. Yeah. To see depressed patients that were on the verge of suicide getting their life back, to see people that woke up and went to bed every day with anxiety lose that. You know, I actually reached out to a person who's building an incredible mental health center in Mexico, because I wanted to know if they were going to do that collaboratively. And they said, yes, we're doing it collaboratively, but they met within Western medicine only. And to me, that isn't collaborative. That's just working together, right? Collaborative truly it's not multidisciplinary either. Multidisciplinary is garage medicine, because you can just go into whichever garage. Right. When you're truly collaborating on a case, it means all your heads are in that, and you're all putting your 2 cents in about how you can help that case. Sometimes I don't know. I don't know what I don't know sometimes, right? So it's nice to hear.
And I think
try this.
And people don't respond. I always say it's like there's different doors that open that healing process. And, you know, I mean, definitely you'll never hear me say anything negative about Bowen, because it's been a huge part of my practice. But if a person doesn't want to get touched, they don't want even light touch, it's not the right door for them, right? Then we have to use something else that allows them to sort of unravel their story and then know what may make sense, you know. And it's interesting, but I do find there's so many people, especially in mental health, and that's one of my big passions currently, is really understanding how the physiology of our body can change through specific touch. it's not necessarily, and again, this is not saying other touches don't work for the effect that they're wanting, but with bone therapy, you know, you affect the vagus nerve, you affect the parasympathetic system, which is so necessary for the healing process. You take the anxiety, literally the physiological anxiety out of the body, it changes everything. And you get people to go, wow, I now, you know, I can stand straighter. And we know the impact of the structure on how we feel. And if it's easier to open up, everything changes, right? So it's like it's a positive
Feedback
cycle of, you know, yeah. And then people can go, well, now I do need to sort through some of the things that happened, and that's fine. There's a place for some of that, you know, without going to repeating the negative patterns that we've been in. But we need our stories told, and we need resolution, and we need different things. And, you know, gut health, it's massive too. You know, if you're not eating right, it also impacts your mental health. So it's like looking at everything and going, what does this person need to have the most impact first? So they actually know that we're trying to, or, you know, we want the transformation. We want them feeling like they're in charge of their health and totally better.
So, I mean, that I think what puzzles me so much is this, why Western medicine and why doctors in it, other than, you know, I think they're taught that Western medicine is truly the only science-based medicine that there is, and this is it. And other medicines are woo-woo and quackery and blah, blah, blah. I mean, in some ways, I felt last year and the year before that naturopathic medicine, it was kind of like the witch hunts again of the 1600s and, you know, 1400s. Yeah. And I'm like, really, aren't we? I didn't even engage in that. There was, you know, there's too much good medicine to be done within clinic to start even listening to that. And I do not understand how, if you are putting in Diet 7-Up or, you know, some kind of aspartame and Twinkies and crap and sugar, how you expect your cells then to make exceptional cells, how you expect your body to make exceptional immune systems, if that is your building block, right? If that's what you're feeding, if you're fueling your body, because, you know, if you're driving an elite car and you put in terrible gas, it's going to run funny, right? I mean, that makes sense to us. If we feed our dogs amazingly because we want them to feel well, and then we're perfectly willing to put toxins into our body, that makes no sense to me. And I don't understand why that is such a threat, right? Why is that such a threat in Western medicine? I understand, you know, I'm not a conspiracy theorist, but so I understand the power of pharmaceutical giants. I understand that, but maybe now it's a perfect time to start looking outside the box. Mm-hmm. Where is each other? Where are the places that we can work together in? What do we excel at? And instead of constantly being fear-based and angry, let's start going, well, you know what? I agree with that. Let's do that. This is a little bit, I don't understand that very much, because the fear comes from lack of understanding. Mm-hmm. I don't understand that. Can you explain it to me? Or let's not do that together yet. I don't know if I'm going to see it in my lifetime in medicine, but I sure hope so. I sure hope so. I have a few years left, Manon. Few good years in me.
It seems like you have quite a few, my dear. No, I guess I think the first thing is the acknowledgement that there is a system problem. I think, you know, and from the many doctors I've talked to, that is a pretty strong consensus. It's that a lot of them feel limited because of the time, and because their training guides them basically. I mean, I've had doctors say, I feel like I'm a first pharmaceutical peddler. It's like, you know, and that is not a happy feeling. So a lot of them that I've talked to have said, you are so lucky. You get to really do the old-fashioned medicine where you get to know your patient, love your patient, and you can see it through. Even if you will refer and all of that, you're in the best position. And I think that's why so many doctors are taking it upon themselves to learn other therapies. I mean, nutrition wasn't even part of their curriculum, right? So I think all of that, I can't help it. I'm always optimistic. That's probably why I'm healthy. But it's like, I see that there's only so long you can defend something that's broken. I also see, though, the forces at play, if, and funding something doesn't mean that it's necessarily 100% biased, because science is science. And at one point, the scientific rigors or lack of will come through.
Right.
But it certainly changes things when medical schools are funded by pharmaceuticals. Like it has to. How could it not? And so I think it's something.
The bias is thus ingrained, right? It is their toolbox, right?
Mm-hmm.
It is their toolbox. I'm just saying that the arrogance that suggests that it is the only toolbox.
Yeah.
Patients are calling for that, right? I don't know if doctors, I think patients will lead the way and will demand a certain type of healthcare, and maybe medicine will follow. I mean, it's happening already. I mean, the supplement and nutraceutical industry is huge. I just worry sometimes that people are taking too many things because it's self-directed based on articles that have been read, right? Instead of seeing a naturopathic doctor. I mean, I often have patients that come in with a bag full of supplements, and I don't think that's healthy either. I mean, I tend to suggest that humans are not necessarily, maracas of supplements. They rattle when they walk, right? I get that sometimes, with some of the illnesses out there, your response has to match what you are battling, what you are effectively trying to change. But I never put someone on a supplement. I've never in 20 years put someone on a supplement expecting them to be on that for the rest of their lives.
Right.
Never. I expect their body to change, and then the treatment plan will change accordingly.
Yeah.
I just hope that more doctors start looking at the possibility that we have something to say and something to offer, and that as doctors we took the same oath, and that we do not want to do any harm, and that we do not want to create chaos, but we do want to heal people, and we want to do it well. It's the same oath we took. We just have a few other lines on the bottom because of we want to do it naturally and with the healing power of nature and looking at the underlying cause. I'm hoping that message gets out there. I would love to do it. I want to work with you on some of my patients from downtown in mental wellness, because I think we're going to be seeing a lot more of that. Right? More anxiety, more worry, more low mood, partly coming from our isolation because we haven't hugged people, right? We haven't hugged people, we haven't touched people, we haven't connected. And it's stressful. It's stressful worrying about our parents' health, our children's health, our ill relatives, our ill friends. There's this sort of underlying low grade, subconscious and conscious worry all the time. I don't know. I felt like I got emotional whiplash. It happened so quickly, right? One day you're in practice, the next day clinic is closed.
Yeah. And the other thing, which is also for me very worrisome, and I've got to be very careful because we as professionals have a gag order on being able to speak completely freely about what's going on. But I question the lack of transparency on the science that is being brought forward. It's like, do we wear masks? Do we not wear masks? Why do we do? Why don't we? you know, I think it was today, I believe NBC, or I forget which station, you know, said that the WHO said, well, it's not the asymptomatic carriers have an extremely low, may not be carriers, and have a very low risk of, you know, infecting other people. And it's like, of course, and that could have been tested right away, you know. So again, it's very hard, and that's that thing I think that needs to change in people, is ask more questions. And we're really raised, and it's our schooling system, it's our family structure, it's patriarchal structure. We're raised not to ask questions and to be obedient. And I have nothing against, you know, obeying, but obey and ask questions, you know, don't
Intelligence.
with intelligence. Yeah. And it's like, let's have this dialogue. And, you know, and I found it very upsetting when I was told I can't talk about the immune system, or that that's something people can work on. Because to me, that's exactly one of our specialties, is understanding very deeply how we're made up and what affects and what are stressors to our body. And so I found that very difficult. Why is it that all we can say officially, or at the time, was, you know, wash hands and isolate? And it puts people into victimhood, as if it made no difference what they ate. It made no difference, you know, getting some fresh air, as if the sun made no difference. As if,
Less stress.
yeah, you know, all of that, right?
Yeah, I know I don't, I think it's time to stand up against that kind of fear-based, I don't know, fear-mongering, right? What on earth is the possible bad thing that can happen from suggesting someone to walk daily, eat 5 colors of vegetables and fruit, drink water, get your sleep, meditate, stretch your body, laugh a bit, connect with others? Truly?
Yeah.
Really? I don't, if someone argued that I'm not allowed to say that, I would absolutely question why. Like, how is that any less important than?
Well, it actually happened to me. So, yeah. No, I was actually called for using the word something about take charge of your health and boost your immune system. And I didn't say, you know, take all these things, because you can't do that as a doctor. It's individualized. But again, it was giving hope that you can do something, you know, yourself, that your immune system matters. Because if you look at what was open, you know, drugstores, alcohol stores, and fast food places, it's like, okay, that's interesting, you know, even worse in the United States. But it's to me, it's fascinating to see, you know, how, yeah, if we need to stand up, what's it going to take for people to feel safe to be wrong? Like, maybe it's wrong, maybe it's right, but let's discuss it, and let's not censor ourselves, or censor everything that's coming out, you know, on YouTube or Facebook. Or it seems like when people ask questions, or they have context to their questions, that's called censorship, you know, or that it leads to censorship. And it's
I don't even claim to understand it all. I do hope that we do start asking more questions, do come back to a bit more common sense medicine, do start working more together, do start being open to possibilities of health and healing, and expecting it. I mean, I think after 22 years in naturopathic medicine, I always expect the body to change. It can't always necessarily be cured or heal fully, but I always expect some kind of a change or a transformation. Something's going to be different. And sometimes that leads to someone feeling absolutely fabulous, and sometimes that leads to someone feeling better. But, you know, you asked me in the beginning, what is it that in essence, why am I still passionate about this? That's why, right? Because with every single case, be it someone who is incredibly depressed or someone that has chronic IBS, I see the change. Every time I see something. And so that's what I think, that's what I love doing. And besides, I love collaborating with people like you and all the people in my clinic. So I truly appreciate this time with you. It was lovely. I hope I get to sit on that deck someday and have a similar conversation.
Maybe we actually need to plan that. Anyway, but thank you so much for coming. And yeah, we're actually over time, so I'm just going to leave it at that. I think your last words were great. And people will receive ways of getting hold of you that'll be posted.
Terrific. I so appreciate it. Have a great day.
You too.
Take care. Bye-bye.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.